Hello, my name is Andrew Sharpe. I'm an advanced podiatrist for Salford Care Organisation, part of the Northern Care Alliance NHS Foundation Trust. My PCAF, my pre-doctoral fellowship, has been to look at diabetic foot ulcer prevention and exploring the role of the multidisciplinary team approach. So just to give you a brief introduction to the subject, diabetic foot complications or diabetic foot ulcers are predominantly caused by sensation loss and peripheral arterial disease, which increases the risk of the skin breaking down and a foot ulcer occurring. Diabetic foot ulcers are one of the main causes or precursors, I should say, to amputations in people with diabetes. And it's why we see a higher level of people with diabetes developing or having some level of amputation, whether that's small digital amputations or full leg amputations. The sequence of events that tends to lead to diabetic foot ulcers is the loss of protective sensation and or underlying peripheral arterial disease. Currently in practice, foot screening will occur to see if patients are at risk of developing a foot ulceration. And once they do develop a foot ulceration, that's when people with diabetes will end up seeing a multidisciplinary team. There tends to be a fragmented, non-joined up, siloed kind of working, either pre-healing, foot ulceration or once the foot ulceration heals and they're discharged from the multidisciplinary team. So what I wanted to look at really was whether the multidisciplinary team approach could be effectively used in preventing either the first occurrence or particularly at first the question was to look at whether we could stop subsequent amputations. But throughout the process of reading and developing the research question, it's looked at all forms of prevention with the multidisciplinary approach. Diabetic foot ulcers have a massive financial impact in terms of it's around about 1% of the NHS spend, 10% of the diabetes budget, or £1 billion to give it a monetary figure, is spent on diabetic foot management, and it has a significant patient impact for those that go on to develop foot ulcers that lead to amputation. The impact is in the region of about 13 times the cost of treatment in terms of the social care need. So the learning and progress throughout this pre-doctoral fellowship has been varied. So in terms of getting back into a formal academic program, my academic writing has been revisited. I have previously done publications for peer-reviewed journals, but getting back into a academic assessed and academically presented piece of work has required me to adapt the structure and the analytical writing style that I use from more recent experiences. It's been a really good opportunity. The pre-doctoral fellowship has been a real good opportunity for professional development with other PCAF colleagues and networking through people who've done PhDs and research fellowships. Also attending international conferences and national conferences have been a real big help, which has been supported through this process. The mentorship and peer support that's come alongside it from the ARC-GM, from the Northern Care Alliance has been absolutely brilliant. I think without that, I would have perhaps struggled a lot and potentially not seen the time through without the support, because it's been absolutely crucial for me to navigate the choppy waters of research. And it's helped also with regards my writing and refining the question that I'm looking at, the research focus. Within this process, I've also been involved in a patient and public group, and that was done early on in the process to help focus the question, to make sure that it is kind of a real world value. And that was a really good opportunity to be able to do that. And that was done through the support of my supervisors. And that was absolutely kind of revolutionary a little bit, that I wasn't necessarily expecting to take so much from it. I'm aware of the process, but I think I've only really ever paid lip service to it, and seeing how important it is to the process has been fantastic. So the training that I've done has been to actually do a master's module through the University of Manchester, which was on critical appraisal and evidence synthesis. I completed that module, and that again helped me with my academic writing, and critical appraisal skills have come on from doing that. Being involved in the patient and public group has been a real big learning opportunity, and being aware of different methodologies. So my pre-doc has been to look at a scoping review protocol, and being aware of methodologies that I wasn't necessarily aware of going into this process has been a part of my training and learning. At the start of this, I did a Gantt chart. I thought this was how my time would play out, but really the challenge has been working to a timetable and appreciating that this isn't necessarily a linear flow that you think it's going to be, and accepting that things do change and need to change. The work, research, life balance, the roller coaster that you go on, it has been a challenge. It's been something that I've gotten more comfortable with as time's gone on. Actually finessing the research questions, switching from a kind of a clinical brain into a research focused mind, and separating the two out has been a difficult challenge in terms of wanting to write in a clinical style, and remembering this is an academic piece of work, and it requires a kind of a rigorous research process that you need to go through, and that's been an excellent learning curve and a challenge as well. As I've mentioned, revisiting the academic writing style, my critical appraisal skills, getting into the swing of critiquing and reading for the purpose of critiquing has been good, but it's also been a challenge at first. Focusing on the relevance, so when I'm reading different articles and journals, it's making sure that it's for the purpose of the fellowship has also been a challenge, and then getting back into the searching strategies that come alongside doing a academic piece of work. So what's been my output and impact? Working towards finalising a scoping review. It hasn't been written up for publication as yet, but that's the next steps. Having that real world focus has been the hope that this can have an impact and support other clinicians and support guidelines in the future. I have done some presenting in terms of webinars and things, and the knowledge and learning that I've taken from the PCAF. It's not been directly on the subject of the PCAF, but it's underpinned. So the next steps I would like to do is to look at presenting this at relevant conferences, and I would still consider developing this research fellowship proposal going forward to be a competitive doctoral fellowship, appreciating that there's still time and work that needs to be sorted to get this into a competitive framework. I'd like to thank everybody at the ARC-GM who've supported me throughout the process, in particular my supervisors, Professor Joe Dunville and Adam Hack, who've been absolutely brilliant and supportive along the way. The ARC-GM guys and the regular meetups we have been, like I say, absolutely essential for keeping me focused on the project and keeping going. The guys from the Northern Care Alliance research team who've also helped, and from other colleagues doing the pre-doc who have supported me along the way. Thank you very much for your time, and thank you for listening.